Imagine discovering a twin growing inside your brain. Yes, inside your skull. That's exactly what doctors found in a 1-year-old girl in one of the rarest medical cases ever recorded. Stay tuned to hear how a parasitic twin lived for a year within her, how doctors discovered it, and how a surgical team performed this astonishing extraction. But first, if you like mind-blowing medical stories, don't forget to like, comment, and subscribe to the Grey Matter Files and Lies, and hit the notification bell so you never miss updates. What is fetus-in-fetu? It's a rare anomaly in which one malformed twin becomes enveloped by its sibling during early embryonic development. Normally, cases are found in the abdomen, not in the brain. Worldwide, only about 200 cases have ever been documented, and intracranial occurrences inside the skull are even rarer. In this Chinese case, the parasitic twin was concealed inside the brain ventricles of the host child. The mass had recognizable skeletal features, vertebrae, femur, tibia, even finger-like buds. The host child, a 1-year-old girl, was brought to doctors because of motor delay. She could not sit independently. Her head circumference was abnormally large, 56.5 stenum, a sign of hydrocephalus, excess fluid in the brain. Interestingly, she was not having any classic signs of intracranial hypertension, that is, no vomiting, no irritability, no downward deviation of the eyes. CT and MRI scans revealed hydrocephalus, brain compression, and an intraventricular fetiform mass. The mass had structures resembling a vertebral column, femur, tibia, and even limb buds. Spina bifida was also present in the parasitic twin. Genetic sequencing showed that the host child and the parasitic twin shared identical single nucleotide variants, that is, they were monozygotic, but the parasitic twin had additional de novo copy number gains, indicating genetic instability. How does a twin end up inside the brain? The authors proposed that during early blastocyst or neural tube formation, an unseparated blastocyst allowed one twin's developing forebrain tissue to envelop the other embryo during neural plate folding. Another key difference: fetus-in-fetu is distinguished from teratomas by features such as the presence of vertebrae or organ arrangement. Neurosurgeons carefully planned and excised the parasitic twin from within the ventricular system. Such operations are extremely delicate given the mass is embedded among vital brain structures. Details from the published report are limited regarding the post-operative neurological recovery, but the successful resection itself is miraculous in such a setting. Because intracranial fetus-in-fetu cases are so rare, fewer than 20 intracranial reports globally, this adds to the medical edge of this story. This case reveals how copy number variation could play a crucial role during embryogenesis when development goes awry. The parasitic twin carried extensive de novo gains in genetic copy number beyond the shared baseline genome, hinting at genomic instability in early development. Clinically, it teaches us to include fetus-in-fetu in differential diagnoses when faced with intracranial masses in infants, especially when imaging shows vertebral structure-like features. Beyond that, advancing prenatal imaging, fetal MRI, and even molecular diagnostics may one day allow earlier detection of such anomalies. This case also highlights human resilience and the marvels of surgical innovation. Behind these scans, there was a little girl with dreams to crawl, move, play, whose own twin lived unseen inside her brain. Thanks to the skill, courage, and persistence of medical teams, she was given a second chance at a life free from that parasitic burden of her twin. Cases like this remind us medicine is not just science, it's a deeply human quest. If you found this story as mind-blowing as I did, don't forget to like, comment, and subscribe to the Grey Matter Files and Lies. Hit that notification bell so you never miss our next fascinating medical deep dive. What should we explore next? Let me know in the comments. Thank you for watching.